Welcome. This is Near-Death Experience 101. It's really for those people who don't know much about NDEs and want to kind of get the down and dirty of the characteristics, after effects, and that's what we're going to talk about today. The slides you'll see from a combat perspective, and all near-death experiences pretty much have the same characteristics and after effects. But since we're really engaging our veterans, this is the perspective I'm going to take. I'm going to talk a little bit about characteristics, and then Debbie will talk about some things, and we will just continue until we're done talking and you're done asking questions. The objectives are to let you know what a definition is, to really have you hone in on the characteristics, understanding there are about 15, universal, around the world, and the after effects. Really important for you to understand them because they will affect you psychologically, physically, and sometimes you need to understand what they're about so that you can just integrate them into your life. We'll talk a little bit about authors and NDE research just so that you know what's happening, and provide guidelines for providers. The very good questions that the psychiatric panel had, and we want the nurses and hope that they are here. I got started at a very young age as a nurse, understanding NDEs as Debbie did, and so we're happy that you are going to take over the flag and carry on from a nursing perspective. A near-death experience is when a person has some kind of clinical crisis, and could be an accident, could be a traumatic event, could be surgery, and they go on to experience 1 to 15 characteristics that are universal. And your experience can be as valid if you have 3 characteristics as if you have 15, and really important to understand the universality of these characteristics. And that we understand at this point that Raymond coined the phrase near-death experience, and people sometimes assume that means you have to be near death. That is not true anymore. We know that people have them in many different circumstances. Certainly when we're talking about combat NDEs, we're talking about experience that happen either in a war zone, during combat, could be a training accident, but in a military environment. Who has them? Everybody. Any age, anyone, any gender, any culture, religious or non-religious. We have atheists and agnostic who have them, any individual people. About 5% of the general population have NDEs. These are just a couple of polls that were taken. This is a long time ago, and we certainly wish they'd do a new one, and that was in 1997. The U.S. News and World Report estimates there were about 15 experiencers. And when they do that, they do not include children or the elderly. So it's really much, children they think are unreliable, and they assume the elderly are confused. Neither of those are true. The incident actually of children is quite higher. About 70% of kids who nearly die have near-death experience. Most children have their experience during near-drowning accidents. The Lancet article with Pin van Lommel and the Dutch cardiac arrest patients, they had 12%, 1 in 8 who talked about having an NDE. What are the circumstances? Combat, extreme trauma, heart attack, near drowning, electrocution, you've heard that a couple of times, TBI, traumatic brain injury for the combat folks, accidents, car accidents, all kinds of accidents. Allergic reactions, being just very sick. George Ritchie talks in his book there, one of the very early ones, he had a horrible fever. He was on his way to the military to come on active duty, and he had pneumonia and almost died, and had a near-death experience during that time. So, characteristics. Watching your physical body being separated from your spiritual body. Patients will say, I was in the ER, I was watching them resuscitate me. I could see and hear everything that was said. And you can imagine how disorienting that would be, that all of a sudden you're watching your body from the ceiling. And patients will tell us, I thought I was dead. I didn't know what happened to me. I was up there, but I could hear and see everything that was happening. Imagine the implications of that. Of course, we know nothing strange ever happens during resuscitations or surgery or any of these things where doctors all of a sudden, oh my God, and they're watching that whole thing. And so it is very disorienting for people. Meeting a religious speaker or figure, somebody that is a spiritual being. People will say, I saw angels, I saw God, I saw people in robes, and so it's not unusual for people to do that. I think one of the most common things that people talk about is the light, the warmth, the surrounding love of the light. And for many people that represents a feeling of superior being, of God, but the light is really an important part of it. A panoramic view, experiencing the feelings of others. What this is, and I always, when I'm disheartened that something horrible happens and some mean people really need to get a life review, I always think they'll get this. They're going to get this on the other side. This is an experience where all the room, all the walls would be filled with experiences you had in your life. If you were a bully, if you did nasty things, if you hurt people's feelings, you will experience it from the other person's point of view. So you will feel that sense of being bullied. And this is a real wake-up call for people. Sensing a border or limit where you can't go past. Some people talk about the tunnel. A place where all knowledge exists. You know everything. You want to know something, you just think it. You just ask. I want to know about religion. I want to know about this. You won't come back with all this knowledge, but you will come back with some of it. Certainly many of these events can be witnessed while out of your body, and then you get a chance to talk to people and validate them. The sense of love and light, once again, most important. The City of Lights, kids talk about that a lot. I died, they're very straightforward. I died, I saw this place, they had lots of lights, they had light beings, I saw God, and they just say whatever. The most interesting ones for me that really validated early in my life when I was questioning all these things were children. Because they would say to me, I remember this little boy, and he talked about, I saw my grandfather, my great-grandfather. He was from England. He died in a fire. His wife's name was Sarah, and I saw where they lived. And he went on with all this information that he had gotten from the other side during his near-death experience. And he had never been off the city block where he lived. So then he told his parents, and fortunately his parents listened to him. But they didn't know anything about this either. So they went and researched this information, and everything he said was true. And one of the greatest problems with children is parents don't listen. They say, oh, it's okay, it was a dream, don't worry, you know. And then these children suffer in silence for a long time because they're not going to ask a lot of other people once they've been told by their parents. So being greeted by deceased relatives and pets, always important. And I think, you know, another thing that you can validate, the heightened perceptions, very multi-sensual. Many people, and PMH talks about this, you can see music or you can feel color. And it's really quite an interesting phenomena with some of these things. A sense of having knowledge of the future. Some people have predictive dreams they talk about, or premonitions, and certainly one of the things that can happen. This is very important, the messages regarding life's purpose, especially for those people who might have attempted suicide. Because a lot of these people, the reason they did is they don't have an idea what the purpose of their life is. They don't know what to do. And so getting a sense of life's purpose really makes a big difference. A sense of oneness and interconnectedness. This, when I see this, I always think, this is my Chloe who has passed over. And one day I hope to see her. The whole business with interconnectedness. I once had a sergeant call me up. He had had an aneurysm, which for the medical people in the room, most of those people die before they ever hit the OR table. And he was old school, very old school. And after his experience, and he had a prominent near-death experience, he said, I've got to come and talk to you because I think I'm going crazy. And he would wake up in the morning, go outside, see the birds singing, you know, ponies romping, and he cries. Or anything to do with nature or oneness. And for any of you who have been in the military or know anything about the military, there's no crying in the military by sergeant majors. That does not work out well. So he really was a mess about this. Very, very, just didn't know what was happening. And it was really a matter of sitting down with him and saying, it's okay, it's normal. This is how you're going to feel. These after effects can appear months, even years later. And they're lifelong issues that can affect the experiencer for a long time, both in a physical way, a spiritual way, and an emotional way. Deb?
Hopefully you've heard Diane saying already that this whole situation is ineffable. People try really hard to tell us what it was like, what they felt, what they saw, and they keep correcting themselves. Well, if you've talked to somebody yourself as an experiencer, you know what I'm talking about. You've tried to say something and the person's face looks at you like, what? Well, I can tell you, and Diane will attest to this, as we've listened to patients and brought it up with somebody else, another nurse, another doctor, whoever, and they've looked at us like we're crazy. So those of you who are experiencers and you've tried to tell somebody like us, and other people look at us like whatever, some of it's because of conversation. We don't know how to express ourselves. So if you're trying to tell somebody that you went to Colorado skiing and they've never been skiing before, and you try to explain snow, well, it's white, well, not really white, it's cold, but well, not really cold. You can say what it is, well, not really, right? So you've seen people try to express it, and I can tell by some of your faces, yep, that's exactly what happened to me. So looking at the after effects, looking at the characteristics, and listening to somebody completely, because not everybody who has an accident has a near-death experience. And as Diane said, you don't have to be really dead before you have a near-death experience. So hopefully we can listen to people and what they're not saying and really hear. And so, of course, some of the after effects play into this. So, having said that, yes, looking at the after effects, and many people will tell you that in their experience, as Diane already told you about the light in the tunnel, et cetera, okay, that's what they experienced in it. Afterwards, many people say that they're very light sensitive, that light brings to them a different situation than it brought before. They're very altruistic. You've heard Bruce talk, others of us talk about how a person is no longer what they were in their belief system before. The gentleman was a cop and mean and bad. When Diane talks about veterans, I can tell you that I've had veterans say to me, when I went over to Iraq, I was a badass. They taught me how to kill, and that's exactly why I did what I did. But now, no. Since I've come back, peace is what it is. What am I supposed to do? Tell people, Diane said you can't cry in the military, and I'm telling you that when they try to tell somebody, I don't want to go over there and kill anymore. No, I don't want to go to Afghanistan. Thank you very much, because I don't think killing people is right. So an after effect could be something that is completely different from the situation that you were living in before. Some people say that adults become more silly, more childlike, more fun, etc. Maybe laughter and joy is not what they had before, but now it is. So how does that get interpreted by others, their family, and so on? They're more friendly, they're more loving, they're more creative, intuitive. Now you can imagine if a child who's 6 years old is suddenly very intuitive and telling others and etc. Is that child making up things? Well, is the 83-year-old making up things? No. They just have more of an insight, etc. Interested in many things that they were not interested in before. Some people tell us that they came back with a knowledge, some kind of skill. And so we've had in previous IANDS conferences, what one of our speakers was, he's a physician, but he came back as the accidental pianist. He didn't know anything about music before. He really liked music, but he didn't know how to play. So this is a perfect after effect example that this person could play the piano and so on. And other after effects are very difficult for people to go on and live with. So I can tell you that something as a nurse that's really fascinated me, and I've tried to help other healthcare providers realize that one of the huge after effects is they lose the fear of death. So, you know, ladies and gentlemen, that's cool whenever the 90-year-old says, I'm going to be with Daddy. I'm not afraid. I didn't choke when I did that near-death wonderful thing, so it's okay. Now, they don't want to die this afternoon necessarily, but they're okay, and they're not afraid to die. Now, if that's the 90-year-old, that's cool. But what if it's the 3-year-old? What if it's the 4-year-old that's yours, who says, Jesus needs me to dance. The angels want me to play. This child's not afraid of death at all because he has no reason to be afraid. How does mom and dad and everybody else handle that lack of fear of death? They become more spiritual. You've heard many of the speakers talk about people who are agnostic, atheists, etc. They're not religious necessarily. And that's what one gentleman told me. Well, I mean, I'm not like in a denomination or anything, but I'm very spiritual. I'm not religious, but since then, I'm very spiritual. So ladies and gentlemen, we need to listen to that and figure out what does that even mean to the individual who's talking about that. Some people do exactly the opposite. They have less religiosity, if you will, but more spiritualism and connecting with spirit, etc. So what is it like for that person or those persons? They might feel like they're easily distracted. They think abstractly, which is, again, very different from them and their personality and so on. They have a complete disregard for time. Now, one of the reasons is because you've heard PMH and others talk about how their watches don't work anymore and things of electricity just don't work anymore for them. So, okay, they've lost their sense of time because they can't tell time or have a way to tell time. But they've also completely decided that time isn't that important. So you can tell we are trying to keep that time thing going on here. They're more generous. Many people say that materialism and the things that they had before in terms of wealth, etc., that it's no longer important. Well, I can tell you about a gentleman, and Diana and I both like to teach through examples and share through examples. And I will never forget a gentleman. I was in a cardiology practice. I was the clinical nurse specialist and all the heart stuff. We did open heart surgery on a patient, and y'all have probably met a man like this in your life. He was a jerk. If you've ever known someone like, yeah, he was a very rude person. And when he would come to our office before his heart surgery, he was very rude to everybody. He almost was abusive to his wife, and he wanted to be seen right now. And when he wanted me right now. So that was the guy I knew, very impatient, etc. He has open heart surgery. Something happened. He needed to be taken back, and then he was brought back to the ICU, and he was pretty nice, and I didn't know much about that, what was the deal there. And so when I went to see him, he said something to the effect of, "It's okay." And he was very peaceful, and I thought, he'll get over that. He'll get back to his jerk self. He came into the office, and he didn't have his wife. And he was very kind, and he was patiently waiting in the room, and I thought, wow, this is pretty cool. And I thought maybe he had the flu or something. What do I know? So he came in. I was doing his 12-lead EKG, and we were talking, and I said, and I didn't know how to really say it, so I said things like, well, how was everything in the hospital? How was the food? Anything you want to talk about? Well, this is a great beginning. Well, no, never mind. No, go ahead. It's all right. No, never mind. That's a good beginning, y'all, isn't it? I don't know what to say, and you'll think I'm crazy. And so I said, no, go ahead. And he said, well, this is going to sound really crazy. And I said, okay. And he said, I saw my grandmother. And I said, really? And your grandmother is deceased? And he said, yeah. And I said, okay, go ahead. And he said, you believe me? And I said, I have no reason not to believe you. Is there anything else? He said, well, I mean, I just feel so different. Okay, what does that mean? Well, Deb, I can't work anymore. And I said, okay. And I said, I don't understand what you're saying. But he said, my work, what I've been about. And I said, what does that mean? And he said, it's always about money. It's always been about money. That's what this is about, is money. And now since I've had that experience, it's not about money. And I don't want to do that anymore. And I said, okay. Because I'm thinking it's about his incision or something, and he got mad at me. He said, no, it's not about that. Who I am now is completely different. So really what I want to do is no longer my work, where I've lied for money, cheated money. Ooh. And so I'm really learning about this man's history, and he said it was all wrong. And now what I want to do is just give up all that, give up my money. Don't tell the doctor. Don't tell the doctor. And I said, because he said, he'll make me get a psych consult. Isn't that interesting? The patient already thinks that. So I said, it's okay, I won't tell the doctor, etc. He left, and I went home that day, and I thought, this is so cool, Mr. So-and-so's nice now. And all of a sudden, I thought about his poor, precious wife. For 40 years, they'd been married, and he'd been a jerk. And they had plenty of money, and she liked her lake house and her Mercedes. Yeah, she did. And he wants to go work at the jail and volunteer his time and not work. So you've heard all of us talk about after effects. Some people are divorced. Many people are divorced. It's higher than the national average, is it not still? Yeah. So point is their materialism can take people in a completely different way, different time, etc. So they can't be too generous. And so going from there, in terms of relationships, those often change very much. Some of their old relationships might be different, might be the same. So that's something we should all listen to again. How about if they have now a life purpose? You heard Bruce say earlier, people come back and they know what they should do, what their mission is, etc. I remember a woman who had a near-death experience in surgery, and in surgery she learned that God wanted her to come back. Her job was to help people realize suicide was not the right way. So she knew the only reason she came back is because suicide was something she could help other people learn, that there's a better way. So that was her life purpose when she came back. Also sensitivity to taste, all kinds of different features in their life, and aromas, etc. Psychiatric, yeah, you know that psychiatric thing. Psychic phenomena, people say, I just suddenly knew, I have an intuition, so it's just something that I came back with. That's the way they're not forgiving anybody or themselves. They're just talking about now, that's how I am. An interest in learning, they want to know as much as they can about everything. Changes in the whole thought process. We've talked about the intelligence, the other skills they have. Curiosity, again, they want to know everything. Body shock. Tolerance to chemicals or intolerance to chemicals. Many people will say, I can no longer take these drugs. This is something I can't do in terms of, it could even be food. So chemicals of any kind they might have a real oversensitivity to. Multiple sensing. Electrical sensitivity, again, we mentioned that already. Light, sound, sensitivity. Also having difficulty with families and other people having a different perspective. Again, we talked about near-death experiencers have a high divorce rate. And so some of that has to do with back to relationships and onto family perspectives, the way they see life differently, their purpose in life. Lower blood pressure. So what I just said to you right now through this is those of you in healthcare looking at patients' overall symptomatology, their vital signs might be very different after their near-death experience. Less tolerance for medications, which we've already mentioned, and little tolerance for violence. As I told you about the gentleman who didn't want to go to Afghanistan, even though he learned how to kill people quite well. Remembering the experience and trying to, excuse me, have that detail that they've just come up with forever, less materialistic, and so on. Okay, in terms of research, Diane, you want to say some things about Eben and others?
I just want to make one comment about the after effects. Things that seem like they would obviously be really positive, like the less materialistic. I once knew a man who came home and gave his paycheck to some woman he saw on the street with a baby. He had food, he had shelter, so he gave away his paycheck. His wife was not excited about this. And so, and some of them are struggle. I have a nephew who is a near-death experiencer, and he has great deal of empathy. Well, a large degree of empathy in an 18-year-old means they date every little needy person out there because they want to help them and fix them. So you have to try to teach them and work with them and look at those after effects that on the surface look great but could have some extenuating circumstances. We just want to talk about quickly, most of you may know this. If you haven't read these books or met these people, you should try. Eben is here this weekend. He will be talking, and his book, Proof of Heaven, is in the bookstore, and he has a new book out now also. He was a non-believer as a neurosurgeon and then went into a coma for 7 days and for all essential purposes wasn't alive, and came out of that after 7 days with no cognitive problems, and went on to now preach the word of his NDE to other doctors because they are pretty much the last holdout. Nurses know about them. They may need to know what to do about them, but they get it. Dr. Mary Neal is an orthopedic surgeon who died during a kayaking accident in Chile in some very remote area, was trapped under the water for really I think it was 30 or more minutes, under the waterfalls, could not get out. Eventually the pressure from the waterfall broke both her legs, and so that she could kind of float out. And no vital signs, but these are friends of hers in the middle of Chile jungle, and so they started CPR. And her story is really remarkable also in the bookstore. Why are NDEs difficult for soldiers and service members? Many times they see their buddies who were also injured or killed. And I've had them describe to me, I was up here floating and I could see the spirits of everybody else who was hit in this attack, and I knew who was going to die and who was not. And it was a great sense of responsibility because he knew he was going to be okay. they really are afraid that nobody will believe them. It's very difficult to talk about this in the military, more so than in just life. Very emotional, very personal. I actually started my work in Vietnam in 1969. Some very young man called me over. I'm a second lieutenant. He calls me over and said, I got to tell you something, but you got to promise me you'll believe me. And in the intensity and the emotion that he had, and it's 1969, Raymond didn't write his book until 1975, so he describes what was really a classic NDE. I have no idea what it is, and I say to him, this is an extraordinary experience, and you know, I really support you and I believe you, but I had no explanation for him. And that was the curiosity link that drove me to today, some 40 years later, where I'm still looking to help these people and do something about it. Military folks somehow think it will affect their benefits. That if people hear about this, they won't believe them, and somehow it'll get in their records, and it'll be over. And some may want to stay on active duty and believe it'll affect their security clearance, and in fact it would. So there are some real issues with security clearances. They're going to have after effects that could be a problem. The violence, the light, the sound, all those things are very prevalent in military environments. The military providers and the VA providers just kind of lump them into the PTSD groups, and that's not what they need. They don't need medication. They don't need to be in those groups, and in fact, it probably would cause more harm than good. If they were addressed correctly, they may be able to heal themselves and really provide some recovery for them. But a lot of times the providers don't have any idea what an NDE is, which is really, really sad. Commanders are not going to understand. You're not going to go to your commander and say, I came out of my body and, you know, this is what happened. I was stationed in Germany. I actually had a commander of a dental unit call me, and he knew that I understood this stuff, and he said, I don't know what to do. He said, here I am in the middle of Germany. I have all these young troops, and they get in trouble. They're always doing stupid stuff, and I want to just go put my arm around them and say, we'll work it out. It's going to be okay. Well, those of you who come from the military, putting your arm around them and working it out isn't the way that works either. And it's just very sad because they're going to be compromised. I'm going to let Debbie talk about the guidelines.
First, I want to add to when Diane's talking about the military perspective, I have completely the opposite. I really don't know much about military, and so what does it have to do with anything? I was called by a VA counselor, and he asked me if I would talk to one of the patients because he wouldn't share with the counselor, the patient wouldn't share with the counselor what had happened to him. And he said, I think it's one of those things you do. And I love that, you know, those weird things. And so I said, okay, go ahead. And so he said, do you mind if this guy calls you? I said, not at all. And so the patient told me, I'll just call him the individual now. The individual told me he really would like to talk to me, but he would not meet me at a hospital, at a church. He told me where we were not meeting. And so I said, how about a park? And he said, okay. And so we described each other. And so I'm sitting in the park, which is right by a hospital, so I would feel safe. And so I'm sitting there, and I see this man walking towards me, and he has what looks like a briefcase, and what in healthcare we see with a jacket or a sleeve for a chest x-ray. It looks like that's what he has in his hand. So I think, well, that must be him. So he comes over to me, introduces himself, and so we started talking. And he said, at 19 years old, I was in Vietnam. And Diane will appreciate this. He said, I don't know anything about what he's telling me. He said, and I was a point man. And I said, okay. And I have no idea what he meant. point man. And so he described what that was, and he was kind of in charge. And he said in his language, he said, and then, my guys took them one by one. And they were there. They just took one after the other. So I assumed that meant that the guys all got shot. And he said, and then I knew it was going to be me. I knew the radio was gone. Nobody was with me. I knew that I'd go down fast. And all of a sudden I took it, and I took it. It was over. And I'm just listening. And so he said, and I went up. And I, in my ignorance, said, in the clouds, because I thought up was that way. But I'm here to help you understand that up could be over there, or up could be over there. Up is not that way. It's more out. And you've heard about vertical perception and all that. So there he was on the ground in Vietnam, dead. And he said they put him in a body bag and zipped it up and put him with all the other bodies in the helicopter. And remember, I don't know a thing about all that over there. I'm just listening. And so he said, so all of a sudden, I don't know what happened to me, but I must have done something where the medic unzipped the bag, and maybe there was something going on. Now, I'm thinking as a nurse in an ICU, how when we resuscitate people, how it works. And so he said, I don't know, something must have happened with my eye or whatever, but he decided that it was time to resuscitate me, and did. And then they took me over to a MASH unit, and I was doing terrible. Well, here's, we've been talking about proof in the pudding. He hands me a telegram that was sent to his mother that said, we regret to inform you that your son has been killed in the line of duty at Vietnam. I'm holding this telegram in my hand. And he said, so I wasn't really dead yet. I was terrible. And so they did this. He broke all kinds of things in this injury, etc. So the long and short is, he said, then his mother gets, I have the second telegram in my hand, and your son really didn't die yet, but he is in critical condition, will probably not live, blah, blah. So he's there longer, and he gets a little better, and the third telegram I get to have in my hand says, we are happy to inform you that your son is recovered, and he will be. Can you imagine being the mother of a 19-year-old who, first of all, had to go to Vietnam, and then second of all, got killed in Vietnam? Well, not really. He's not really dead yet, but he'll die. All of a sudden delivered back home to you in your arms. Oh, my. So his near-death experience is not something he would share with anybody at the VA. Diane already told you why. What about discounts, et cetera, et cetera? So the long of being discounted and then perhaps ranking and so on. So I want you to hear from a person who knows nothing about that military stuff and then being referred to by a military person, if you will, in the VA. It's amazing, ladies and gentlemen, what you can hear if you just listen. So obviously, that's the thing we're going to do is listen, listen, listen. And remember, listen and silent have the same letters. You just mess them all up. And so shut up. Be quiet. When a person is trying to tell you something, listen, because you might not understand the words. It's an ineffable situation. Certainly don't judge them. Make eye contact. Help them understand that you really are there. People talk about therapeutic presence. That's, again, when you shut up and listen and look at them as much as you can. Perhaps touch, unless they're a soldier that can't touch other people, like Diane said. So providing any kind of resources. It might be something in their church. It might be something with IANDS. It might be something in terms of physical care, but what kind of resources can we give them and help them be able to grow and go from there? Helping them understand that it's okay that this happened, and you don't have to explain it away. You don't have to tell exactly how it happened, and we're not going to analyze it. Also, certainly help them understand that IANDS is there and available for us. Look for clues and cues from this individual. And those of you who are in healthcare, you know how it feels when you resuscitate somebody. And I can tell you in my ignorance, when we resuscitated a gentleman and when he started talking afterwards, he said, I hate you people. I can't believe you made me do this again. I don't know what that means. I just know that now we made him get back in his body. And some of you are shaking your head like you know exactly what I'm talking about. I understand that getting back in your body is the most god-awful experience. And so if somebody's trying to tell you about how angry, when you resuscitate somebody successfully, you think chocolates and flowers, that's a good thing you're going to get, not slapped and being mad and et cetera, et cetera. I can't believe you people made me do this. So I had a doctor call me one day, a cardiologist, and he said, will you talk to this patient? Why? Because she wants to fire me. Okay, why? So I went in her room, and she was a pretty tough woman. And she said, okay. He started asking me questions. He said, sit your ass right down there. I'll tell you what happened to me. And so she starts telling me about how the doctor pulled her back through the black plastic. The doctor pulled her back through the black plastic. I only know she was resuscitated. And that's exactly right. She was, and the team brought her back. And she said, getting back into my body was the most god-awful thing that ever happened. And so you want to explain that? Yeah. You have an 8.5 foot, and you're going to try to squeeze it into a 3 shoe. That's how it feels. Awful. Putting me back into my body. So once again, she didn't like that. And so we talked about maybe that she came back for other reasons. The end of the story is she decided not to fire her doctor then. And I saw him about 2 months later, and I said, how's she doing? And he said, she didn't fire me, but she's still mean as hell. So that's just the way she is. So again, looking at guidelines, talking to the family, listening to people who have been caregiving as well as in the family and so on. Don't assume that just because the person has, let's say in their medical record that they're Catholic, don't automatically call the priest. I've told you that people have said to me, I'm not religious, I'm just very spiritual now. So don't assume that certain people would be good for them or not good for them necessarily. And also let them be okay with enjoying the experience and bringing it back and talking about who they saw and so on. Now, Diane and I both tell you there is a difference between near-death experiences and near-death awareness. So they are very different, but people sometimes confuse them because, or maybe in the sound of telling it back, it sounds confusing because they watch your face to make sure that you know what they're talking about. And sometimes they really are talking about loved ones who are deceased coming to take them away. And that might be a nearing death awareness. So listen very carefully to all that. Their cues and clues again. And so if they're encouraging them to write it, journal it, tell other people about it and so on, how can we carry this forward? Also, the clues and cues might include us listening to the patient and listening to what they're not saying. That's another big one. You can put it in the medical record and so on, if at all possible, please do that. And then also look at articles, things we've talked about here. Diane told you about many things that are books and references, resources, looking at what IANDS can offer to you. And also be with the patient, for example, when they're trying to tell others, tell their loved ones, tell their partners, etc. So that would be a good thing. Now, I am particularly interested in I've been in critical care my whole life, but now end of life and ethics are the two things that I love most now. And I can tell you that people in palliative care, they're not in hospice. They're not necessarily dying now. Palliative care is about symptom management. And so if someone's had a near-death experience and helping people understand what this is all about in language. So if it's a near-death awareness or near-death experience and they're trying to work through certain symptom management, that might be, again, kind of confusing. So listen carefully is the bottom line there. Maggie Callanan, some of you heard yesterday talking about the Final Gifts book that she wrote, is a wonderful situation talking about patient after patient that had nearing death awareness. And so some patients may have one or more near-death experiences. It might be something that they have in the dying process, not necessarily in the process that Diane told you about earlier. Help people understand what's going on with the patient, and that otherwise they might miss important conversation, communications, etc., with their loved one. So clues and cues. Strange dreams. I can tell you, Bruce and I were talking yesterday about the fact that some people don't know what words to use, and I've seen patients say, especially children, they don't know what to call it. They call it a thing, I went there, etc. Kids do that. But adults may say something like, well, I had this weird, and watch your face, dream. Why would they say I had a dream? Because dream's a pretty safe word. Maybe they'll go all the way out to say vision. So vision or dream, if they keep watching your face and you're like, go on, then maybe they can tell you something else about that experience that they really had. So they might have kind of a distant look on their face, like they're really not there or whatever. Again, listen to them, see what they're responding to, the lights, the sounds we talked about earlier, lack of fear. So I think you've seen all this. Looking at our resources, near-death experiences, Diane's going to say a few more things about veterans.
I personally think this is a huge issue. We know we have hundreds of thousands of veterans that have come back with traumatic injuries, with the multiple deployments. They have PTSD issues. And then on top of that, they have a near-death experience which they can't tell anybody about. They're afraid to talk about. And nobody in their vicinity really knows much about it. So at IANDS, we are going to try to really provide a better environment for us to be there for them. We're going to put a web page out there. We're going to do a movie about veterans and why it's important for them to talk, and we're going to do several things which we'll be trying to fund after the first of the year probably. And so just know that, and I tell them, if you want to talk to a veteran, call the office and I will talk to you, because many of them won't talk to anybody else except another service member who knows what they've been through. So we know that there are many out there, they just don't know about us, and we want to be the ones to help. We want to be there to help. So lead them to IANDS. We have a combat brochure, actually, that you can print off our website. We have several brochures, and you can print them off and give them to your patients. I used to put a packet together, and I would have a couple articles in it, a couple of brochures, a resource list of books, and I would send patients and their family home with this if they brought up the whole concept of NDEs. So we want to be able to answer some questions. So if you have some, please go over to the microphone.
And also, you heard Diane mention about children, and we really would like to have more children's situations, perhaps have a panel discussion and so on with children at the IANDS Conference. And I'd like to share a story with you about many of you may be called in your church, school, healthcare, whatever it might be, circle of friends, where somebody wants you to listen because they think you listen well. Well, in a situation in the pediatric intensive care in one of the hospitals here in San Antonio, the nurses called me and said, there's this kid we want you to talk to, because he's that weird stuff. Once again, that weird stuff that I love to talk about. So I went to talk to the child, and other people just watched me. Well, remember, I don't know what this child's about to say. I don't know anything about his experience. So I said, so what happened to you? And he said, my mommy always told me don't run across the street. It wasn't a street, it was the HEB parking lot. Well, here in San Antonio, that's a big grocery store. It was the HEB parking lot, and I had my pizza. I didn't need anything. I didn't want anything, and so I was just running, but it wasn't a street. And so when that white man hit me, I didn't need anything. I didn't want anything, and he told me I couldn't stay. He told me, go away. And so once again, you know how children speak in fragments? It's not like a whole sentence or anything. And so I said, go ahead. And he said, and so when that white man hit me, it said, don't come here. No, you can't stay here. And I said, who told you that? That voice. And so he's just, answering my question. And that voice, did he tell you anything else? What else did he tell you? Look at the straw. I said, look at the straw. Did you look at the straw? Was there anything in the straw? Remember, I'm trying hard. Is there anything in the straw? Yeah. And so you looked in the straw. Can you tell me what was in the straw? My mommy, she was crying and crying next to that fireman man. Now, fireman man in my language is a paramedic, okay? But this 3-4-year-old, he just used all his own words when he went there, and that voice, etc. And so that fireman man and his mommy. Now, you want to know what really happened? He was hit by a white pickup truck that a man was driving. He told me it was the white man. Okay, white man, pickup truck, hit him. He really was in the parking lot, hit, running across the HEB parking lot, really with his pizza in his hand. And now he's laying there being cared for by 2 groups of paramedics, and his mommy was crying and crying next to him. Now, ladies and gentlemen, I don't know about you, but that's real proof to me. He didn't know any of that stuff, and all I did was listen in the words of a child telling me, and a straw sounds kind of like a tunnel to me. And when we're talking about the characteristics, many people say I had no human wants or needs. I had no fear. I had no cold, hot. I wasn't hungry. This child said he was eating a pizza. I didn't have any. I didn't want anything. I didn't, etc. So hopefully you're hearing us say that many people have characteristics that are very much the same, and kids tell us how they want to tell us.
Are there any questions that we can answer about this or comments? Hopefully we've given you the bird's eye view of NDEs, and of course there's thousands of them on our website, and all kinds of information, articles, books. One of the things we want to tell everybody, if you have tickets for healing, please go sign up for the Time and Healer, because right now we don't know how many more healers we need or don't need, because not everybody's gone down to the healing session and picked who they want for whatever day for the rest of the conference. So please go sign up so we can make a better evaluation of what we need to do. Thank you very much. Thank you. When you see a veteran, please thank them for their service, and we are really appreciative of that. And Debbie's got to have the last word always.
I always have the last word, absolutely. What I want to remind us, some of you are here for the first time, and some people who are at IANDS conferences for the first time ever in their life, they've actually shared their near-death experience. So why am I telling you that? Hopefully the networking and the coming together will be joyful for you, but remember the people around you often just need to connect. They want to tell their story, and it's the first time they felt safe enough to tell their story. So
I'm going to be in the experiencer room right following this at 1 o'clock. If there's somebody that'd like to come and share personally or privately, it's in the Crockett room, and I'll be there for a while to listen, talk, discuss. Thank you all very much for sharing this time with us.